Today we will learn bladder meridian of foot Taiyang. The urinary bladder's upper outlet connects to the kidneys through the ureters, while its lower outlet connects with the urethra. The urinary bladder has exterior-interior relationship with the kidney. The physiological functions of bladder include storing urine and discharging urine. First, storing urine. The urine is produced by the kidney qi transformation and is stored in the urinary bladder. Therefore, the function of the urinary bladder depends on the functions of kidney. If kidney yang is deficient, the bladder will close and open abnormally. It will result in profuse night urination, enuresis, and incontinence of urine. Second, discharging urine. Urine can be excreted naturally out of the body through qi transforming function of the kidney and the urinary bladder. If the kidney and bladder lost their functions, it will lead to dripping urination, incontinence of urine, anuria, frequent urination, urgent urination, aldinuria, and so on. Usually, acute micturition disorders are related to urinary bladder, while chronic cases are related to the kidney. The relationship between the kidneys and the urinary bladder. The kidney and the urinary bladder form an exterior-interior relationship through their meridians connection and affiliation. The turbid part of the water in the body is transformed into urine by qi transforming function of the kidney and transported down into the bladder, while the discharge of the urine is the main function of the bladder. At the same time, it is adjusted by the function of qi transforming and qi controlling of the kidney. The relationship between the kidneys and the urinary bladder lies in their interdependence and mutual coordination in the production, transformation, and excretion of the urine. Pathologically, if kidney qi is deficient, it will affect excretion of urine with the manifestations of lower back soreness, dysuria, and enuresis. If there is damp heat in the urinary bladder, it will impair the kidney, which can result in symptoms like frequent urination, urgent urination, and painful urination. The bladder meridian of the foot Taiyang includes main causes and two branches. Main causes 1. The bladder meridian of foot Taiyang starts from the inner canthus, ascending to the forehead. It joins the dual meridian at the vertex. Branch 1. From the vertex, a branch arises, running to the temple. Main cause 2. The straight portion of the meridian enters and communicates with the brain from the vertex. It then emerges and descends along the nape of the neck, where it splits into two branches. Branch 2. The first branch from the nape runs downward alongside the medial aspect of the scapular region and parallel to the vertebral column. It reaches the lumbar region, where it enters the body cavity via the paravertebral muscle to connect with the kidneys and join its pertaining organ, the urinary bladder. Then the branch of the lumbar region descends through the gluteal region and ends in the popliteal fossa. Branch 3. The second branch from the posterior aspect of the neck runs straight downward along the medial border of the scapula, passing through the gluteal region downward along the lateral aspect of the thigh. It meets the preceding branch, descending from the lumbar region in the popliteal fossa. Here we have a point, bladder 40, 尾中, mainly used to treat back diseases, as two branches join together here. Main cause 3. From the popliteal fossa, it descends to the leg and further to the posterior aspect of the lateral malleolus, then running along tuberosity of the fifth metatarsal bone, it reaches the lateral side of the tip of the little toe, where it links with the kidney meridian of foot Shaoyin. Let's summarize. What are the related Zangfu organs and tissues of this meridian? Eyes, brain, kidneys, urinary bladder. Collateral vessel. The foot Taiyang collateral vessel arises at bladder 58 Taiyang, 7 cun above the lateral malleolus, and connects to the foot Shaoyin kidney meridian. Disorders of the foot Taiyang system. First, meridian disorders. Disorderly meridian qi ascends, resulting in headache, pressure as if the eye might become dislodged, neck strain, back pain, wrenching pain in the lower back, inability to flex or extend the thigh, restriction at the popliteal fossa as if the tendon were bound, and extreme calf pain known as huaijue. The meridian is used to treat tendon-related disorders, hemorrhoids, malaria, mania, depression, head and neck pain, blurred vision, tearing and runny nose, nasal obstruction, nosebleed. Additionally, it treats neck, back, lumbar, sacral, coccyx, anterior knee, calf, and foot pain, as well as immobility of the little toe. The bladder meridian runs along the back of the body. There are many muscles on the back: trapezius, latissimus dorsi, erector spinae, gluteus maximus, biceps femoris muscle, and gastrocnemius muscles. So its response problems are muscle or tendon-related syndromes. Second, collateral vessel disorders. In collateral vessel disorders, the excess pattern presents as nasal obstruction and head and back pain. The deficiency pattern presents as nasal congestion, runny nose, and nosebleed. To treat, use the lower connecting point, bladder 58 Taiyang. Summary of bladder system meridians. Disorders of the bladder meridian: headache, pain at the upper orbit, pain and rigidity of the neck, back, and lumbar region, swelling and pain in the patellar, gastrocnemius spasms, pain and swelling at the dorsum of the foot. Disorders of the Zangfu organs. Meridian qi of the Zangfu organs gathers at acupoint on the back along the first lateral line of the foot Taiyang bladder meridian. These points are significant in diagnosis and treatment of diseases of the internal organs and their related tissues. Extraneous febrile diseases: Taiyang cold syndrome, wind invasion, malaria. Mental disorders: depression, mania, epilepsy. Disorders of the eye, nose, and anus: blurred vision, tearing, allergic rhinitis, nosebleed, nasal congestion, hemorrhoids, prolapsed rectum. That's all for today. Thank you.